Iron deficiency is the most common nutritional deficiency worldwide. Now, there's different levels of deficiency. You could lack iron a little bit, which means you're not going to have a lot of stamina in the gym, you're going to be unusually fatigued, and you're going to catch every cold that goes by, because iron's needed for many things. If you're severely deficient, it's called anemia. There are different forms of anemia. This one is called iron deficiency anemia, and it's the most common type of anemia. It's a condition in which your blood lacks the healthy red blood cells, and that's a problem because red blood cells carry oxygen around your body. So iron deficiency anemia, obviously, it's due to insufficient iron for whatever reason. Now, without enough iron, your body can't produce enough of a substance in the red blood cells that enables them to carry oxygen. It's called hemoglobin. This is very important. Hemoglobin is the red stuff inside your blood cell. It's centered on iron. Now, your heart is pumping blood past your lungs 80 times per minute, so once every 3/4 of a second. In that 3/4 of a second, the hemoglobin has to be capable of snapping up the iron in the lungs and carrying it and distributing it throughout the body and letting it go where needed. It's iron that gives hemoglobin that quality. If you have iron deficiency anemia, oh man, you have a lot of symptoms. Just lacking iron in general, you're tired. But when you have iron deficiency anemia, you can have extreme fatigue, shortness of breath, weakness, no stamina. You could feel lightheaded and dizzy, brittle nails. Your tongue gets swollen and sore. Oddly, this is odd, unusual cravings for things that lack nutrition like ice and dirt or starch. Many of us just lack iron a little bit, not anywhere near the level that you would classify as anemia, but just lacking the iron, like I said before, it affects you. It affects your immune system, it affects your energy. So welcome to our How Do I Know I Need Iron episode. Hi, my name is Jerry Hickey. I'm a licensed pharmacist who also has studied nutrition. I'm over here at Invite Health. I'm also the scientific director, and I'd like to talk to you today about everything to do with iron. Please subscribe to the Invite Health podcast, and please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. All of the information on today's episode will be linked in the episode description, and you could visit invitehealth.com/podcast for more info. So let's get started. So here are symptoms of iron deficiency anemia: a severe lack of iron, extreme fatigue, weakness, pale skin, chest pain, a fast heart rate, your heart is beating fast, shortness of breath, headaches, dizziness, lightheadedness, you might faint, cold hands and feet, inflammation and soreness in your tongue, brittle nails, poor appetite, especially in kids. In adults, there's evidence that lacking iron to this degree can increase your risk of having a stroke or developing Parkinson's disease. It's also involved with restless leg syndrome. So what's that? In restless leg syndrome, your legs get this vague kind of muscle pain at night. You get this unquenchable desire to move your leg to get more comfortable. So it really messes with your sleep. And iron seems to be one of the things that helps that. So what about if you just lack iron a little bit? We'll discuss this and more about iron, such as tests and what iron you should take when we come back from a short break.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Okay, welcome back. Lacking iron just a wee bit leads to colds and poor immune system function, fatigue, a big drop in your endurance, and basically you go to the gym and you get on the exercise bike and you can't stay on it for very long. A pale, lackluster look to your skin and your lips. So let's talk about anemia. What leads to anemia? The most common causes of iron deficiency anemia is a lack of iron in your diet. So we're talking about a severe lack of iron, okay? But of course, your diet affects. It can lead to just low levels in general. Any digestive tract issue that affects iron absorption or the absorption of nutrients, like sprue and celiac. That's the problem with gluten, or colitis or Crohn's disease. Any issue that leads to bleeding, such as the microbleeds related to taking aspirin and ibuprofen. That's right, if you take aspirin and ibuprofen every day or naproxen, it irritates the lining of the digestive tract and you can have microbleeds. It can actually lead to anemia. Obesity interferes with iron absorption. The regulator of iron absorption and iron release from the body in the liver is affected by obesity, and it blocks you from absorbing iron, which is kind of crazy. You would think that people who are obese would have more iron. So does gastric bypass surgery for weight loss. People who've had gastric bypass surgery, bariatric surgery, they have trouble absorbing a lot of different nutrients. In fact, I always give them a powdered multivitamin to make sure they're getting enough nutrition. Pregnancy, you're eating for two, well, basically, I guess 1.5, that can lead to anemia. What about low iron? Well, not quite to the level of anemia. That's common in vegetarians and vegans. They often don't suffer from anemia. I mean, come on. Iron's found in beans and dark green leafy vegetables such as spinach. You also get it in dried fruit like raisins and apricots. And of course, they fortify cereal and breads and pastas with iron, and you get iron in peas. The problem is it's not heme iron. Heme iron is found in red meat mostly, but also fish and poultry. And it's a lot easier to absorb than the iron in vegetables. So iron is absorbed better from red meat. It's called heme iron than the iron that you get in vegetables. For instance, I don't eat red meat. It's not because I'm concerned about a health issue. Of course, there are some connections to health issues with red meat consumption. But if you have red meat once every couple of weeks, what's that going to do? Come on, you're treating it like dessert. It's not going to do anything. But I feel bad for the animals. I do. I mean, these animals are intelligent, and I just don't like it. Because of this, once in a while I start to feel like I'm a little fatigued. So I take an iron supplement. This happens about every 4 days, and almost immediately I have more energy. Now, vegans especially may need an iron supplement every once in a while, along with some folate, that's a B vitamin, and B12, and the sulfhydryl amino acid taurine, because these are needed to create red blood cells, and also they're needed to create hemoglobin, and all of these nutrients are commonly lacking in a vegan diet. Iron deficiency anemia is dangerous. These are statistics from the CDC for the year 2017. Over 12 million Americans develop iron deficiency anemia, and iron deficiency anemia leads to about 778,000 trips to the emergency room and over 5,300 deaths each year in the USA alone. Now, you can usually correct iron deficiency anemia with a good iron supplement. So I'll discuss the forms of iron available later on in the episode, the ones I think that are better. Sometimes additional tests or treatments are needed for iron deficiency anemia, especially if your doctor suspects you're bleeding internally. By the way, once you have anemia, it takes a good solid year to replete the amount of iron stores in your body. Now, what enhances your ability to absorb iron from vegetables and beans and iron fortified foods and even iron supplements? Well, vitamin C. There's things in foods that block the absorption of iron. What vitamin C does, it takes the iron in your food and converts it into a form that's very absorbable called ferrous iron. There's other things in food like citric acid, malic acid, tartaric acid, and lactic acid that enhance the absorption of non-heme iron. So non-heme iron is the iron not in meat or fish. But oddly, taking meat, poultry, and fish along with your iron supplement or along with the vegetables that contain iron, for some crazy reason, improves the absorption of iron, and it's not clear why. But there are also things that block the absorption of iron from your food. We'll talk about these. We're going to do a quick break. When we come back, we'll discuss these inhibitors of iron absorption in your diet.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Okay, welcome back. Jerry Hickey for Invite Health Podcast. The episode we're talking about, hey, do I need iron, basically. So what inhibits the absorption of iron from your food? Phytic acid. It's found in legumes like beans and lentils and soy foods. It's also found in whole grains like wheat. It's found in nuts and seeds. It seems to bind to the iron and prevents its absorption. Just a small amount of phytic acid in your food can reduce the absorption of iron by about 50%. So the absorption of iron from beans and peas and lentils and soybeans and mung beans has been shown to be as low as 2% because of the phytate content. 2%. But the way you prepare the food, like when you soak the beans, when you ferment soybeans, and the cooking, that helps degrade the phytates, the phytic acid. Now, polyphenolics in coffee and black tea and herbal teas can really inhibit the absorption of non-heme iron. But if you have some vitamin C present, it'll help block that effect and you'll absorb the iron better. Soy protein. This is different than the phytates found in the soybeans. Soy protein has been found to inhibit the absorption of iron. It's only partly related to the phytic acid content. So tofu would inhibit the absorption of iron. Calcium seems to inhibit the absorption of iron, and so does the mineral zinc and magnesium. So always take your iron separate from these products. Like these are commonly found in bone supplements. Yet if you have a balanced diet, it seems to negate the effects of other minerals on iron. So what does iron do for us? It's in hemoglobin. Iron grabs the oxygen in your lungs about 80 times per minute, and it releases where needed in your organs and systems and muscles. So it makes hemoglobin. But in your muscle, iron makes myoglobin. And myoglobin is kind of like hemoglobin, not as complex. But it attaches to oxygen in your muscle, and it allows your muscles to function when you want to exercise or do something physical. So if you're eating a piece of chicken, the dark meat is where you find the myoglobin. That's where you find the iron. Now, in your brain and your eyes, there's another component that's similar to hemoglobin and myoglobin. It's called neuroglobin. Neuroglobin contains iron. And neuroglobin strongly binds to oxygen when there's a lack of oxygen in the brain or in the eyes. Think of a stroke. And this helps prevent the death of brain cells. It protects brain cells from what we call hypoxic conditions. You also need iron for your antioxidant defense. It's at the core of a compound called catalase. That's important. There's 3 powerful antioxidant enzyme systems in your body that let you lead a long, healthy life. Glutathione, superoxide dismutase, and catalase. Catalase is huge. You have to make it. Catalase breaks down peroxides. So when you think, your brain is using energy. When you use your muscles are using energy. When your heart beats, it's using energy. A byproduct of energy is hydrogen peroxide. Hydrogen peroxide will kill your cells in your brain and your heart and your muscles, everywhere else. Catalase breaks down hydrogen peroxide into usable oxygen and water. And it's thought that one molecule of catalase can work 1,000,000 times to reduce hydrogen peroxide. Otherwise, you wouldn't make it out of the cradle if you didn't have enough catalase. Iron is at the core of catalase. So it's really important for your antioxidant defense mechanisms. Now, iron is also needed by your immune system. Let's discuss this. It's very important. Flu, cold season, coronavirus season, all these things. Neutrophils are the most common granulocytes. It's a type of white blood cell. You find it like by your nose and by your tear ducts of your eyes and in your mouth and by the lungs and in your stomach and by your skin and in the urinary tract and in women's vaginal tissue, etc. And it's floating all over the place, these neutrophils. They release things. They're a type of white blood cell that releases things to kill viruses and bacteria. So how do neutrophils do this? They engulf the infectious organism in a process called phagocytosis. And then they release something called a myeloperoxidase. The myeloperoxidase is like hydrogen peroxide. You know, when you were a little kid and you cut your knee and your mother got out that brown bottle and she poured it on your knee and all the tissues bubbled? Well, that was hydrogen peroxide. So your immune cells have myeloperoxidases that do the same thing. They oxidize and kill viruses and bacteria. What they use as a weapon is iron. So iron, on one hand, protects you when it's in the antioxidant catalase, and on the other hand, it kills infections. Okay, let's go to a quick break. When we come back, let's talk about some common signs that you might just lack iron a little bit, which can affect your physical performance when you're exercising, your energy in general, and your immune system. We'll be right back. Jerry Hickey.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Okay, welcome back. What are signs that you lack iron? Well, your lips look pale. Your skin is kind of like lacking luster and it's pale. You're catching every cold that comes your way because your immune system isn't working well. The palms of your hand, they don't have that reddish color. Now, there's blood tests. They're needed. Bear in mind, like all minerals, iron has its sweet spot. Too little and you feel horrible, but too much is no good. So there's a range that iron falls into. So therefore, if you truly lack iron, you need a blood test. So they look at iron in the serum. That's the colorful part of your blood. The blood could be broken down to plasma, the clear part, and the serum. So the serum iron test measures the amount of iron in your blood. Then there's a transferrin test. You're going a little deeper now. It directly measures the level of transferrin in your blood. Now that's important because transferrin is what transports iron around your blood. And about 1/3 of your transferrin is saturated with iron under normal conditions. So you might want to see the percent saturation of the transferrin, how much iron is actually in the transferrin. This is important because if the transferrin saturation is low, that means you don't have a lot of iron for the future, and you may become low in iron in sometime in the future. And then there's also serum ferritin. Serum ferritin measures the amount of iron stored in your body, like in your liver. So the serum ferritin test measures the stored iron level in the body. So that's why you can't just depend on ferritin. You also need the serum iron test and the percent saturation of the transferrin and transferrin test. Now, what about types of iron? Normally in a hospital or in the doctor's office, they give you ferrous sulfate, and I've got a problem with that. It's really well absorbed. That's not the issue, and it has a lot of iron. The issue is it commonly makes people nauseous. It causes stomach pain. It causes severe constipation. People hate it. They don't take it. And then there's a much more gentle iron, the kind I use. It's called iron bisglycinate. Iron bisglycinate is tremendously well absorbed. It does not cause nausea, it does not cause stomach pain or cramps, and it does not cause constipation. It'd be good if you also got some B12, some folate, some vitamin C, and some taurine along with the iron, because these are needed to not just to create red blood cells, but also to create hemoglobin. Now, thank you for tuning in to the Invite Health Podcast. You can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Make sure you subscribe and please leave us a review. Follow us on Facebook, Twitter, and Instagram at Invite Health. We'll see you next time on another episode of the Invite Health Podcast, and thank you so much for listening.